Well, June is Alzheimer's Awareness Month, and we've partnered with the Alzheimer's Association to help answer your questions and concerns about possible symptoms and how to deal with a diagnosis.
In today's Your Family Now, we're looking at why an early diagnosis is important even though there is no cure.
I leave my office, didn't know where I was going. I couldn't remember what I was trying to do.
Mike Eubanks was only 58 years old when he learned he has Alzheimer's disease.
I think we almost expected it.
Most commonly, people notice a change in memory. And they'll notice some themselves, but their loved ones will also notice that people are very forgetful, they repeat things, they misplace things.
Dr. Daniel Merman is a professor of neurological sciences at UNMC. He says the dark colors on these brain scans show low activity. This would be an advanced patient.
In casual conversation, there were no nouns, no specific things, like you kind of talk around things. You couldn't name a person or even name like a pen or a watch.
Dr. Merman recommends going in as soon as you or a loved one notices symptoms. Doctors do a memory test and brain imaging, and lab work may show the memory loss is actually the result of something treatable.
I would say a lot of young patients come in and it's not Alzheimer's disease. We see things like sleep apnea, medications, sometimes depression.
If it is Alzheimer's, an early diagnosis may allow a person to take part in clinical trials, including ones at UNMC. And there are FDA-approved treatments available for the symptoms. Eubanks takes meds for what he described as mental fogginess.
Early diagnosis helped me because they were able to start me on some medications that help with my cognitive function.
There may not be a cure, but a diagnosis does allow you to connect with resources and learn you or your loved one are not alone.
Let me have it. Uh-oh.
And we have a list of those resources through the Alzheimer's Association with this story on 3newsnow.com. Alzheimer's is complicated, but having a conversation about it doesn't have to be. Next week, we'll explore how to talk to a loved one about the disease and common concerns families have.